So welcome to the third annual Local Partners Meeting session on supporting prevention and clinical outcomes through social and behavior change. My name is Margot Paulson, and I'm the Social and Behavior Change Advisor here at the USAID mission in Zambia. I will also be the moderator for today's session. Next slide, please. The objectives for this session are to illustrate how social and behavior change approaches are being applied to support prevention and clinical outcomes in Haiti, Tanzania, and Mozambique. The second objective is to share lessons learned that local partners can consider if they want to adapt or replicate. To help us reach these objectives, we have three speakers who will be joining us today. Johnny Selicourt is joining us from Haiti, where he is working as an SBC specialist for Panos Institute that is currently implementing the USAID PEPFAR funded Undetectable Equals Untransmittable, or U equals U campaign. Before joining Panos, he spent the last 15 years working as a senior communication advisor for various local and international NGOs in different areas ranging from HIV/AIDS, child sponsorship, WASH, distance education, social communication, social marketing, emergency communications, and health communications. He also did countless communication consultancies for high-profile organizations. He holds a bachelor's in social communication from the State University in Haiti, along with diplomas in digital video production and video editing. Johnny, if you would like to just turn your video on for a second if you're able and show your face, you're more than welcome to do so at this time. Secondly, Annie Bulwalda is joining us from Mozambique, where she is the senior project manager for Nueti in Gaza province. She has worked with Nueti since 2017 and provides leadership to the PEPFAR funded Dreams project since 2020. Prior to joining Nueti, she worked as a sexual and reproductive health specialist for a youth-led organization based in the Netherlands and as a consultant on various assignments related to curriculum development for young people in various African countries. She holds a master's degree in theater and media for development from Winchester University in the United Kingdom and a bachelor's degree in international development with a specialization in communication from Wageningen University in the Netherlands. Abby, if you'd like to turn on your video at this time to show your face and wave, you're welcome to do so. Lastly, but not least, Godfrey Mwanakulia is joining us from Tanzania, where he is the SBC specialist for the USAID Tolonge Afia project under FHI 360. Godfrey has worked for the project since 2019 and provided support to the SBC component covering HIV/AIDS, malaria, maternal and newborn and child health, and family planning. Prior to joining the project, Godfrey worked with Johns Hopkins Center for Communication Programs in Tanzania in various capacities. He holds a degree in journalism and is currently undertaking a master's degree of public health at the University of Dar es Salaam. Next slide, please. And Godfrey, I forgot to mention, but you're welcome to turn on your video if you haven't already done so and wave, but we'll have future opportunities for that as well. This session will be conducted in the format of a virtual World Cafe. I'm not sure how many of you are familiar with World Cafes, but soon you'll be randomly sorted into one of three breakout rooms to hear a presentation. Following the presentation, you'll have time for a short discussion. After 15 minutes in the room, you'll move to another room where you will hear a second presentation. This will continue until you've heard all three presentations. Once everybody has had a chance to hear all presentations, we will reconvene here. In these rooms, you'll be joined by note takers Jacqueline Devine, Susan Leclerc-Modlala, and Esther Broad. Latham Avery and Caitlin Powers will also be assisting in the breakout rooms. You do not have to move rooms. This will be done for you. And so we do hope you enjoy these presentations, and the breakout room sorting will be starting now.
Okay, I just want to share our field experience on community SBC community engagement, especially in health behaviors among PHIV here in Tanzania through the USAID Tolonge Afia project. Next letter. So just briefly, for those who know, furaha yangu in English means my happiness. And this was a campaign designed specifically to position ART as a solution to fears and into what life would be after being diagnosed HIV positive. But also we tries to align immediate use of ART as a way for individuals to take control of their lives and the future. So allowing them to belong to reinvent themselves, but also achieve their hopes and dreams. And so when we are designing our materials, our insights informed us of what are the key barriers as well as enablers to adapting behaviors. And of those, emotional drivers prevailed because people had fears of being tested, or had fears of testing positive, but the desire to belong to, how will my family feel about me if I test positive, but also to control their narratives as well as reinvent themselves to achieve their dreams and live a happier life after knowing their situation. Next. Afan, can you go? So our key objectives were ART initiation if HIV positive, but also testing of partners and children if HIV positive through the index testing, adherence to ART and routine viral load monitoring, as well as TB screening, prevention, and treatment through IPT if HIV positive. Next, please. So our implementation approach, actually, when the campaign started, it was just a test and treat campaign. So it was testing for everyone. But then in year 3, there were some problematic adaptations which were done to effectively reach our audience through targeted approaches. So in the first phase, we had posters, billboards, all the mass media materials, as well as the interpersonal communication materials through the community activities, radio spots, and service invitation coupons. But then when we had these adaptations, then we looked at how we can use the treatment advocates, which were also being utilized under the NACOFA initiative. So what we did was conducted training for treatment advocates so that they can use our materials to reach a fellow with HIV, but also how could these treatment advocates link we also link these PHIVs to the 33 health facilities within the high volume sites. But also these PHIVs did one-on-one IPC sessions with the fellow PHIVs, and also conducted some small group dialogue sessions with the PHIVs. But also there was a form of regionalized mass media activities through the community radio stations, so that they can contribute to what was actually happening in the ground. Next. So what you see here is some of the achievements that we had. I won't speak of for specific bullets, but as I said, we trained these PHIVs, they conducted the IPC sessions. They reached a number of people within those sessions, but also the interesting part is how many clients were linked back to services, as you can see in the slides. But also we had a very good coordination between the facilities and treatment advocates to make sure that those who were lost to follow-up actually returned to the services. On the other part is, as you can see on my screen, if you see the two arrows, the green and the black one, you can see before, and this is for the case of viral monitoring, before the implementation of these activities and after the implementation of these activities, you can see from the month 6 up to the last month, how there were improvement in viral monitoring among PHIV clients. Next. So in terms of lessons, we say SBC activities resonate well when you focus on the key, you address key barriers, and specifically these are emotional drivers that compel or take clients back to the services. So these are motivators as well as emotional drive, but also apart from promoting individual behavior, linking these activities community level SBCC also bring a lot of improvement in our programs, but also the use of treatment advocates points out the importance of the contribution that SBCs can have as part of the larger HIV/AIDS efforts. So the SBC activities need to be continually harmonized with service delivery to maintain the gains that we have seen. So for us, now linking our SBC activities with the service delivery through these 33 high volume sites was one among the success that we achieved. Next. So thank you so much for being here. Lathan, back to you.
Okay. Thank you so much, Johnny. That was great. I mean, excuse me, Godfrey. Margot, do you want to, if there's anything you want to add, I can get Johnny and Panos's presentation pulled up for the next presentation.
Great. We look forward to having Johnny present next, and then we'll conclude with Abby following us up. And then we thank everyone again for sticking through with us as we troubleshoot these issues. So Johnny, are you ready?
Yes, I am. Okay, good morning and good afternoon to everyone watching this presentation. My name is Johnny Silicourt from PANOS. I'm working as a SBCC specialist for PANOS Institute. PANOS is currently implementing the USAID funded U equals U campaign in Haiti. Next slide, please, and click, and stuff. Okay, good. So let me just for a few seconds introduce you to PANOS Institute. It's a local organization that has been working in Haiti for more than 3 decades, precisely since 1987, with the mission to amplify the voices of the poor and more generalized through mass media and social media. And PANOS is working in 4 particular fields: climate change, children media, gender-based violence, and public health. And in the particular field of public health, the 3 pillars are transparency, accountability, and ownership. These are some stats about the HIV current situation. Those stats are provided by the Ministry of Health. I'd like to actually point out some, the very high number of last to follow up, 30,000. That says it's clear Haiti has a long way to go to achieving the 2nd and 3rd pillar of 95% goal of controlling the HIV epidemic in Haiti. Next slide, please. Click, and click, and stop. Okay, good, thanks. And in that context, the U equals U campaign has been launched like a year ago in April 2020 with the aim to increase the awareness on OHA. It was very important based on the high number of loss to follow up, as well as stigma and discrimination against the PL/HIV in Haiti. The campaign is being implemented in close partnership with the Ministry of Health through its National AIDS Control Program Unit. So we are now in the 2nd phase. The first phase has been launched in April 21, from April 2020 to September 2021. And now we are working on the designing of the materials for the 2nd phase. Next slide, please. So in terms of communication channel, Panos is conducting media and non-media activities through its communication strategy by working with well-known artists as well as social media influencers and faith-based organizations to easily reach out to this audience across the targeted geographic departments. So artists and influencers have been actually chosen following focus groups held with PLHIV, where they themselves suggest some names from the art community in Haiti. They're taken from them to make positive actions. So like you see, these are some two pictures. The first pictures is artist performance, the theme song of the war during the World AIDS Day last year, and the second picture is a public square. It's a public square, and where we have a screening of the video spot. So next slide, please. Okay, thanks. Okay, good. So during the first phase of the campaign, like I said before, from April 2020 to September 2021, Panos design and implement various communications materials. You can check them out all on our website, or maybe you can go on our social media platforms to see the videos, the spots, and all these posters that we developed. They're all available on the tweet WEE or A-A.com and Creole. So you can just check them out. And in terms of next slide, please. Let me just maybe talk a little bit about, you can just go back, please. It's possible. Can you go back? Okay, good. Okay, let me just for a few seconds talk about the info VIH-Sida in English. Information about AIDS, HIV and AIDS. This is a live streaming show on social media. It's broadcasting on Facebook and Instagram, where we sit down with people working in HIV fields and also with PLHIV folks to talk about the experiences, the work. So in the second phase, we're gonna put the focus on these particular activities by keeping on broadcasting the info VIH-Sida on our social media platform, as well as on traditional media on television. Next slide, please. In terms of lesson learning during the first phase, let me tell you that I said it that we designed the second phase now. We actually learned that spending times to talk with PLHIV, either through focus group or other interpersonal activities prior to design the materials, can lead to better achieve the message audience fit. And thanks to the posters, the video spots, the flyers, we are making easier the daily task of health partners because they can use those materials to raise awareness much easier during the AIC session. Next, please. So from those lessons learned, Panos, as we're working on the second phase now, we will do the best we can to improve the second phase of the campaign by involve more actors from the PLHIV Association in the material design and production process, because in the first phase, it worked very well and we have good results working closely with the PLHIV Association that we're gonna keep doing, keeping the same dynamic for the second phase. And we're gonna also put more emphasis on non-media activities for broader coverage of people with unlimited access to mass media and social media. So maybe you don't know, Haiti is a very mountainous country. So there are some remote areas where social media or mass media or even social media cannot access. That we're gonna put emphasis on non-media activities and keep on working more closely with the faith-based organization to amplify the message with the communities. And the first phase, we work closely with because Haiti is very religious. So with the preachers, the voodoo priests, so we're gonna keep on working in the same dynamic as well with the faith-based organizations. Next. So these are some pictures. I'm showing up what we did in the first phase. The picture number one is young folks in the street doing raise awareness activities by distributing flyers, posters, and stuff like that. And the pictures number 2 is a public screening of the video spot in the public square. There were like thousands of people sitting and watching the videos in the public square in Haiti. And picture number 3 is a private screening for PHLIV Fox. And picture number 4 is a behind the scene of the video spot production. Next. And click. Thank you. This is a poster, one of the billboard that we developed for the first phase, saying small virus in your blood is equal 0 transmission of HIV. Thank you.
Okay, thanks so much, Johnny. Margot, I'll turn it back to you.
Thanks so much, Johnny. Very interesting. And we'll hand it over to Abby to wrap us up on the final and third presentation. Abby, over to you. The screens are up, and just let me know when you'd like the next screen.
Margot, this is Esther. Apologies. I would like to make sure that we have the last 15 minutes of this session dedicated to questions from the participants. So I would encourage us to be as quick as possible when it comes to the last presentation. Apologies, Abby. Over.
That's fine. Don't worry. Thank you, Esther. Thank you, Margot. Let me get right into it. Then I'll be timing here from my side too. Good afternoon, good morning to everybody. Let me take you to Mozambique. We've been through Tanzania, Haiti, and now we're in Mozambique. My name is Abby Bivalda. I'm Senior Project Manager for Nueti, and I'll be giving you a short presentation on how we use SBC interventions to address gender-based violence and teenage pregnancy. The next slide, please. Before I dive into the approach that we are currently implementing, I just wanted to give you a little bit of background about our organization. Nueti is a national organization implementing SBC projects since 2009. And with direct funding from PEPFAR since 2013. Our first project with PEPFAR was called Tuasen. It was directed to promote sexual reproductive health of young people and their parents. And it was a very traditional SBC approach with radio, television program, printed material, but also an mHealth platform, community dialogues, interpersonal communication. And the lady that you see down here was called, she's Big Sister Nueti. Why Big Sister Nueti? It's because through formative research, we found that young people like it most to go to an older sister to ask for advice. So in Portuguese, it is Mana Nueti. And people throughout Mozambique got to know Mana Nueti as the go-to person to ask their questions, either through SMS, Facebook messages. And she was also the key figure in our television and radio programs. And why am I taking you back to a project that was already finalized in 2017? It's because this project really gave Nueti a lot of credibility and visibility as health promotion organization in Nueti. And it therefore continued to support our future SBC interventions. Next slide, please. So that's where I take you now. Currently, we are working with adolescent girls and young women in 2 provinces in Mozambique, but I'll talk a bit about Gaza province because that's the project I'm managing. The main barriers for adolescent girls and young women to fulfill their potential are gender-based violence and teenage pregnancy. So we are dealing with a low rate of disclosure of GBV, which relates to gender norms. And then also there's high rates of teenage pregnancy that relate to the same gender norms, but also a lot of misinformation and myths about contraceptive use. To address these barriers, we work with both the adolescent girls and young women, as well as their parents, caregivers, and the wider community. Next slide, please. So the work we do with adolescent girls and young women, it's a social asset building sessions. The manuals that we use are based on previous formative research, and then because we have an history of implementing, they are have been improving throughout the years based on practical experience. We always try to find the balance between, on the one hand, having a manual that's very comprehensive, that includes all the information that young women need to learn about gender, sexuality, HIV prevention, and all these important topics. On the other hand, we don't want them to be very big manuals with long pieces of text, because it's peer educators facilitating them. And we try through providing the mentors, providing information about GBV. We try that the mentor positions herself as a trusted person, so that young women can disclose cases of violence, and provide the mentors with tools to support and follow up with these beneficiaries. Next slide, please. So what is the work that we do with the community as a whole, the parents, the caregivers? It's community dialogues, and it's important for two reasons. First of all, we need to talk with the parents before, or with the partners of the young women, for them to get permission to participate in the sessions. They need to support what is the content. And on the other hand, we also very much need to talk about these same subjects that we talk about with the young women, to build a support network around these young women, for them to change their behaviors and their communities with them. We also find that involvement of community leaders is very critical, also for two reasons. Firstly, it's also to give the credibility and the importance to the sessions for people to participate, but it's also, community leaders are often the first ones to give us some initial preliminary feedback on the impact of our sessions. And for example, in Gaza province, we heard from community leaders in various districts that our intervention is provoking, in fact, a reduction in teenage pregnancy and early marriage. Next slide, please. I wanted to share very briefly with you a success story that supports our family-centered, community-centered approach, and the fact that to have a real impact in a community, you need to work with different actors, because we find success can be direct and indirect. We had a story that was shared a couple of months ago with us. Teresa got pregnant at the age of 17. She was expelled from the house, sent to the house of the boyfriend, but also the family of the boyfriend didn't take her in. I think we all know too well, all the misery that the girl ends up in a case of teenage pregnancy. And then actually, Teresa did not participate in our sessions, but her friends did. So her friends decided to talk with the mentor, and supported by project staff, the case was taken up to talk with Teresa, with a community leader, with her parents. And eventually, of course, this was a difficult process, but eventually Teresa was taken back into the house, and she is back in school. So this is to say that when girls participate, they are empowered themselves, but they can also help empower the young women around them. Next slide, please. So that is an important lesson learned about that success story, and how it proves the need to have a family-centered, community-centered approach. But besides that, we find that in Gaza province, the social, cultural contact matters a lot. Gaza is close to South Africa, so a lot of young women who are already married or living with a parent, we see that their partner is outside of the country throughout the year, and he is back for the holidays. So mothers-in-law are key to work with, to stimulate the girls to go to the sessions. They need to have they need to give the approval for the girls and young women to participate. Another lesson learned is that the quality delivery of the sessions is key to achieve behavior change. And you don't achieve that through a one-off training. After the initial training to the peer educators, to the mentors, there need to be a very close follow-up, a very close supervision to simulate, repeat the sessions with them on a weekly basis, so that they feel confident, the mentors feel confident to deliver these sessions with quality. And the last lesson learned, it brings us back a bit to the beginning of my presentation, in which I shared that the strong brand that we developed with Big Sister Nueti, Mana Nueti, really helped us throughout our further interventions with PEPFAR. As we see intervention, it really gave us credibility, visibility, and it facilitated us entering in communities when they already know about the brand Nueti. Thank you very much. I will hand it over back to Margot. Thank you.
Thank you, Abby, and thank you also to Johnny and Godfrey. I wanted to open it up for questions. I see one question in the chat box from Avery, so we'll start with this one for Abby. which is, can you talk more about the process of recruiting and training the facilitators, peer educators, and mentors? Anybody else, if you have a question, don't hesitate to raise your hand and we'll get to you next, or go ahead and write your question in the chat box. Thanks.
Thank you for this question on recruitment. I'm not sure if it is something specifically about the recruitment that you're interested in, but what is key for us is that the mentor the peer educator is from the same community as where we're going to work. So once we have mapped where we want to have our interventions, we will start recruiting the mentors, and we work through community-based organizations. So they often already have some social activists with them. So together with the community-based organizations and with community leaders, we try to identify who would be in a good position to be a mentor. She needs to be from the community. She needs to be a peer educator, but she also cannot be too young, because she needs to share her knowledge with the girls and young women. So that is more or less a general reply on how we go about recruitment. Thank you.
Great. And then Jacqueline, I believe you messaged that you had an observation about Haiti, so perhaps I can hand it over to you.
Yeah, thank you. And really thanks to our presenters who went with the punches, and despite our challenges with the rooms, managed to really deliver a solid presentation. So thank you. I want to go back to that last slide that Johnny shared. And it's just an observation for me as an SBC advisor, where you have the 0, and that's on a poster. But I think for me that the powerful image of that, and using that gesture mnemonic, I think could be used potentially in your live presentations, your live discussions, even in community shows, and even provider, where this becomes a code, remember, or between partners. So I would encourage you to leverage the power of a hand mnemonic and carry that out in other activities that you do. Just a thought, but thank you all three for your very passionate presentations. Thank you.
Okay, thank you, Jacqueline. Like I said in the first room, we're gonna work on it. Thanks for the advice. Thanks, appreciate it.
Johnny, I see a question just popped up for you in the chat, which is, you mentioned direct involvement of PLHIV and PLHIV associations in the message design process. What approach did you take to involve PLHIV and tailor your messaging?
Okay, like I said, first we held some focus group, specifically with the PLHIV, and we asked them questions about what they need, how they see the campaign, and did they have some advice to give us? And we took all the inputs that they gave, and we put them in the design process of the materials. And furthermore, we also work with PLHIV as comedian for the video spots. We had 7 video spots, and among them 4 with PLHIV. We had a PSA, like a PSA for 3 minutes with PLHIV. The approach was working closely with the PLHIV to design all the process in terms of message content, in terms of production, be able to have the PLHIV folks all along the process of designing and production of the audio and video materials. That was the approach.
Thanks so much, Johnny. Does anybody else have a question? I don't see any in the chat right now, but I welcome at this time hands to be raised, or if anybody even wants to unmute and ask a question verbally, you're welcome to do so at this time. Well, we're awaiting questions. I had a question come in via private chat, so you're welcome to do that as well. And this is a question for Godfrey. Godfrey, you mentioned that SBC activities need to be continually harmonized with service delivery. How did you do so?
Can you repeat your question?
Sure. It was, you mentioned that SBC activities need to be continually harmonized with service delivery. How did you do this?
This is specific, not specifically for HIV, but throughout the activities that we are doing when we do like one-on-one sessions in the communities or community SBCC community mobilization activities. We want to ensure that we are well coordinated with our service delivery partners, because as a project, we are not offering services, rather we are just doing SBCC activities. So we work with our community, our service delivery partners to ensure that as we are doing demand creation, then the services should be available in those areas. So let's take an example of if you are creating demand for IPT or cervical cancer screening, then you need to have partners around those areas who are also providing such services. So in the absence of services, then if you're doing any demand creation activity, then you won't be able to measure yourself on whether people are going to these services or not. So as a project, we have tried as much as we can to ensure that our service delivery partners are part and parcel of what we are doing. And we have created a kind of mechanism into which whenever we are doing activities or they are doing activities, we support them with these SBCC activities as well.
I have a follow-on. Maybe they want to know, for example, are you having systematic monthly meetings, or sort of what are some concrete ways that you harmonize and coordinate? Because I know that's often a challenge between community and service delivery partners. So any specific examples, one or two?
So we have collaborative meetings here at national level, I think through PEPFAR. We have such kind of meetings, but as well as in the zones and regions that we have monthly and quarterly meetings where partners meet and discuss on various issues that concerns their projects, and in terms of how are they reaching their target groups. So it's a kind of coordinated activities at national as well as at the community level.
Great, thank you.
Thanks so much, Godfrey. I had another submission sent privately to me. I'm still more than happy to receive them in the chat privately or hands raised. So Godfrey, this is another question for you that came in, which is small dialogue groups were a key part of your process, but it can be challenging to get individuals, especially individuals such as youth, to join. How did you recruit and retain people in your group so successfully? Over to you, Godfrey.
Thank you. Actually, young people are the most coming to the sessions compared to the other adult groups, because we have tried as much as we can to make these activities interactive, but as well as create some kind of games which are funny and interesting to them. So young people are actually appealing to our sessions. The challenge usually is for adult groups, because if they are so tied up with economic activities, and that's why sometimes we reach them through their existing platforms. So not for the case of HIV, I can take an example of the maternal and child intervention, where we have the men hangout areas where our CHW would go and meet these men into those existing groups and not creating the new groups. So if men maybe are playing football, then we go and reach them through the places where they play football, and we so integrate our activities within their existing activities and not creating our own standalone activities. So that would be one of the ways into how we reach various groups of our messaging. The same to women groups as well. We look at which activities are the most interesting to them. And so we build up on those activities to ensure that we include some elements of what we want to achieve with our communication objectives. Back to you.
Thanks so much, Godfrey. Very interesting and very informative. I am checking to see if we have any more questions coming in. We still have just a few moments if people have questions that they want to answer. Abby, I just had one come in for you actually. So Abby, are the materials developed available for others to see, use, and potentially adapt? And if so, would any considerations need to be taken? Thanks.
Thank you very much for that question. A lot of our material is, yes, on our website, nueti.org.mz. However, they are in Portuguese, so if another country would want to use them, it's going to have to go through translation. But what might be interesting to say is that USAID PEPFAR is now going through harmonization of materials that we are using in the various the different IPs with that work on similar projects. So we Nueti's manuals were among one of the manuals that are now being implemented nationwide with other PEPFAR IPs as well. So that is interesting. But yeah, I think people might find it interesting to check our website to see, yeah, besides the manuals, the facilitator guides, we also have the magazines there available. So it might give inspiration, even though you might not understand Portuguese, it might give inspiration about how these topics can be presented to young people. Thank you.
Thanks so much, Abby, and a great resource indeed. I think we're kind of wrapping up at the end, as we're at 2 minutes till the hour. If there's any final questions, please go ahead and interrupt now. Questions or comments are welcome. If there's not any questions, I'd like to reiterate what, as Jacqueline just wrote, last call. If no questions, I would like to reiterate a huge thanks to all our panelists for presenting today and sharing unique perspectives from Haiti, Tanzania, and Mozambique. It's been a really great and really interesting session despite the technology issues. So we really thank everyone for their patience. And we also want to thank all our attendees for coming in and taking the time to listen to these presentations today and engage. Okay, I see no further questions or comments coming in. So thank you, everyone, and enjoy the rest of your day.